service to Norwich Hospital.
So in a few moments I'm going to go and get changed into theatre blues. We've just sent for James, who's a young athlete who's been referred up here because he's had problems with kneecaps dislocating. We're going to be following his journey through the hospital, through 2 operations, and then later on through his recovery to find out exactly what happens to him. So James, you remember this boy from clinic. So we met him a number of years ago. He's now 16, but you probably remember him quite well. He's very athletic, he's a very good tennis player. And he started having problems with his kneecaps dislocating quite a number of years ago, which has really affected him quite badly. It meant that he can't play sports at the same level. He can't really do many of those activities that teenage boys like to do. We're going to operate on him today, and these are his X-rays. And so essentially, his problem is that he's got this large bump of bone. So if you imagine that his knee is like this. So his kneecap is meant to be tracking in a groove down here. Instead of having a large groove for his kneecap to track in, he's got a bump of bone sitting just there. So it hits it like a speed bump, it comes out the side, and he's been dislocating. And as you probably remember from clinic, he was dislocating really even in clinic.
So that lump of bone there is not normal?
No, not at all. I mean, he's grown up with it, so as he's got bigger, it has got bigger as well, which is why it's caused much more of a problem.
I mean, the first time I really dislocated my knee, we went to all kinds of different hospitals who had no idea what it was. And of course, this is very unique, so they hadn't seen this before. And we came to Norwich and saw, was it Mr McNamara's predecessor? And obviously he knew what it was, he knew what would have to be done, and he explained it to me. I mean, at that point, I probably didn't have a grasp of what it would involve in the future. I mean, that everything that was explained to me was 5 years in the future, 4 years in the future, so it was all just, to me, it's just going to be a pain for future me, not for me right now. But the realism of it really kicked in with day-to-day life and playing my tennis in the present time later on once I'd recovered from that first dislocation, because there's no escaping my knees from then on for the next 4 years. So after I really started to feel that it was going to be a serious problem, I was looking forward to or grateful to having the surgery. There was no feeling of, I don't think I was ever really worried about having it or scared that something would go wrong, because what's the worst that can happen? At the moment I'm dislocating my knee so regularly that any positive that I can take from this is fine.
He saw his doctors, and then he came to the clinic, and we found out that he had a condition called trochlear dysplasia. We first met James probably about 4 years ago when he was 12. He said that he'd had problems with his knees since the age of about 5 or 6.
57?
55, here it is.
55.
What were you feeling at the time when you were 18?
One time I just went down and we had no idea what it was. And then we would have came to see you in year 8. No, year 8 maybe.
No, it would have been...
You saw my predecessor, didn't you?
Yeah. And that's when it started to roll that we needed to...
It just happened more and more frequently until it was about 10 times in a couple of weeks in the summer before. That was over periods where I was doing quite a lot of tennis, I had my D.V. stuff, and it just kept going, and there was nothing I could do to stop it, even when I was strapped up and did things like that, and gave it a rest. It just kept dislocating, and then that's when we obviously came to try and get the surgery done sooner rather than later.
Iain McNamara is my name. I'm a consultant orthopaedic surgeon, and I'm also the honorary professor of orthopaedics at the University of East Anglia.
I'm James Gill, orthopaedic trainee registrar, and Mr McNamara is training me currently in knee surgery.
Whilst they're doing James over an X-ray,
you can see Hannah and that next door.
So I met James when he was referred to the X-ray department from orthopaedics. He was one of many patients that day, of course. We had to obviously read his clinical information, his history, and provide X-ray images that answered the question that his doctor was asking, basically.
Well, so this X-ray this X-ray is a side view, as you can see here, and he's got about 8 millimeters of bone here. So if you're looking at this view here, here is his kneecap here at the front, his muscles here are going to be at the back, and this is where his groove is meant to be. His groove line is meant to come along here and join this line here that we've drawn on here. As you can see, his groove line crosses there, and it goes up to about 8 millimeters, which is enormous in a knee. And as you can see from the view from the top, here this is his kneecap sitting. It's meant to be sitting in a groove here, and this is completely.
There's no groove.
No groove, absolutely. So it's like essentially trying to balance a golf ball on an orange. Really, the whole thing is just wobbling all over the place. So the idea of this operation is that we're going to open up his knee. We're going to have a look at this bit here, and then we're essentially going to come underneath the surface of the knee, which is the gliding surface of the knee, take away a lump of bone here, which is all of this stuff here, and then drop that back down again, so therefore we recreate a normal-ish groove for him. And then we'll rehabilitate him afterwards and see how he gets on.
So when James came down for his appointment for his pre-op, they took swabs from him to test for MRSA to check that he didn't have any infections. They're also very particular to make sure that you haven't got a cold, you haven't had a cough or a temperature beforehand as well, so you're not bringing anything in when you come for surgery. And then he just walked down with his trainers on down to theatre, and then once he went into the room he would take his trainers off and then he'd get up onto the bed, and that's when the anaesthetist would talk him through, put the cannula into his wrist and then start working on having some oxygen and then putting him to sleep for the surgery.
Hi James, you all right?
Yeah.
Fine, sir.
There you go, my friend.
Fine. Do you want to do your checks?
Yeah, I've done
that. Oh, is that right? Okay, fine. So this is Lorenzo and Harriet. So they introduce themselves.
I'm all right.
So this is James's mum. That's James, obviously. So James very kindly agreed to basically just show us his knees, if that's all right. Is that all right with you, James?
Yeah,
do you mind if can I get you around up the side of the bed? Is that all right? Do you want to swing your legs over? Just so that, just over the side. Can you just lift this knee up in the air for me like that? Just like that. And the knee actually gets stuck, and this one's pretty bad as well, isn't it? And you can actually only get to there. It gets stuck there at that point, and then down again.
I can't.
Yeah, you can't. The knee actually gets stuck. You can't bend it. Let it go floppy. Relax it. And now for this one. And if you push down hard, lift it straight up in the air. And now if you bend the knee, there. And actually, it's quite an effort, isn't it? The kneecap gets stuck. Thanks very much.
Consent form number 2.
Number 2, sign for right knee tracheoplasty plus or minus MPEL reconstruction. And right knee is marked. Sign 22nd. Patient's, is it mum or?
Mother.
Nasby, yeah, it doesn't say the relation.
Oh.
Yeah, his mum shouts, I know. Yeah, fine.
Okay.
It is his mum.
Okay, thank you.
Okay, happy?
No allergies, no metal work. So we confirm patient's name, procedure, site and position planned.
Yes.
So right side
How much
is marked.
blood loss is anticipated?
Minimal.
Are there any specific equipment requirements or special investigations?
We talked about it all. You've got sores, osteotomes. Yep, you've got everything.
Are there any critical or unexpected?
So once he's actually gone under with the anaesthesia, then the porter will walk you back out of the theatre, and there's a contact number that's left so that in recovery room one of the nurses can phone you once he comes round. The surgery itself is about an hour and a half long, but bearing in mind he then has to go into the theatre first and then have the surgery, and then he's got to be stitched up afterwards and then move back through to recovery once all these observations are okay. It tends to be sort of 2.5 hours. So where you're told it will take an hour and a half, if you start timing like I did on the first surgery and thinking, well, that's the hour and a half gone, I've not had the phone call, what's going on, has something happened? It's not, it's just taking longer for everything to be sorted out to make sure that he's comfortable. Second surgery, he then had the epidural put in after he'd come out of surgery. So again, that takes a little while to get that sorted and in properly. So I tend to go down to the restaurant, which is directly below the operating theatre, so I'm sort of 30 seconds away from the entrance to the theatre. Sit down, have some lunch, depending on the time of day it is. Get outside, walk around, get some fresh air, because you're going to be there for a few hours. But the time passes fairly quickly. And second time round it passes even quicker, because I think you've got the confidence to know what's going to happen and you know how things are going to be. And this time round I saw Mr McNamara walk past the corridor, so I knew that surgery had finished, so I made my way back up the stairs and just kind of hung around outside the theatre entrance and then just waited for someone else to walk past that I recognised, and then that got me into the recovery room.
We keep the patient for approximately 4 days after the operation, but after that, support from the family, support from the school, support from the home environment and the physiotherapists in the community is absolutely essential in allowing these patients to fully rehabilitate. As you can see beforehand, the knee was very unstable, the kneecap was dislocating on its own, and when we finished the operation the kneecap was nice and stable. So he's just in recovery, and he'll get brought round to the ward, and then we'll meet him again there.
Yesterday, I remember the time leading up to going to getting my anaesthetic, but as soon as you're in the room and you've had the anaesthetic, there's nothing you can remember. So a good 4 or 5 hours later, you get a lot of sleep from that, which helps, because the first night's probably the most difficult to sleep on, because it's your first time on the new machine, and it's always just a bit, you're coming off your anaesthetic, the drugs are starting to wear off from the surgery, so it's a bit harder on the first night.
And the swelling settling down?
Yeah, it's started to go down now, yeah.
How's your pain?
I've not had any pain since I've had the PCO.
Good, fine. So James is now 2 days post-op. He's progressing really nicely. The advantage that he has is that he's had the other side done, which means that he knows what's going on, as you heard. And really the plan is just to increase his range of movement, and then we're just going to carry on with working with the physiotherapist to improve the bend in his knee, allow the swelling to go down. We're going to do some x-rays to make sure that everything's in the right place, and then just carry on controlling his pain whilst we allow him to rehabilitate.
So I'm James's mum and been here now for a second time. The first time that he had his knee surgery, which was about 7 months ago, we came down because we don't live locally, so we came down the night before and we stayed in accommodation, which meant that he had a better night's sleep going into the morning of the surgery, and it was at 7 AM that he had to come into hospital, so he just had a bit more sleep to prepare for that. So we came in first thing. Once you come in, there's quite a bit of hanging around that you have to do, so you will go through some paperwork, you'll see a couple of nurses, they'll ask different questions. The surgical team and the anaesthetist will come in as well and have a conversation with James. And then it's just a case of a waiting game. You need to wait until your slot comes onto the theatre list.
Fine, I just need to do your obs.
This is going to be the fastest set of obs that have ever been done, isn't it?
And it's definitely boring by day 4, because there's less that you're not getting up to do as much, so you won't have an x-ray or anything to keep you preoccupied. Or
we're going to move the CPM machine, and then we'll help you sit on the edge and just make sure all your attachments are out of the way. So what I'll do is I'll just support your leg again, and then what we'll do, if you can bring yourself around. Yeah, you got it. Good. We are part of the physiotherapy team, and we're here with James today. Obviously he's just recently had his surgery, and what we're doing today is just getting him sat on the edge of the bed, getting his knee moving, for him to start doing the exercises himself, and then obviously getting him up on his feet and trying to get him walking as normally as possible. And then it's just going to be working on getting him walking further and getting him more and more independent, eventually getting him onto his crutches, doing any stairs, anything like that, and obviously getting that knee bending as much as possible. Can you bend that foot and your knee at all? Right, so what we'll do is we'll start by having a stand up to the frame, just to make you feel So a bit of stability, all right. So you just push up from the bed with your hands. That's it. All right. Good. So eventually we want to get to the getting onto your heel, coming onto your toe, and then your toe off. But that will come. What we'll aim to do is we'll see James every day that he's here while he's an inpatient, and it will just be with an aim to getting him more and more mobile, more and more independent before he goes home. So has it just sort of been stopping, all right, randomly?
Yeah.
Okay.
So we've followed James through his operation. We've seen his early rehabilitation in hospital. Now we're going to take him for an x-ray to make sure the x-ray looks good and the bones are in the right place. Then we'll follow him as he goes home and starts his rehabilitation at home. So these are the post-op images of James, who we operated on. He's obviously still rehabilitating downstairs. He's on his CPM machine. We've got these just to check, and I think they look pretty good, to be honest. You know, we've got rid of that large bump of bone. Here you can see on the pictures that we took in the operation that we got rid of that bump of bone, and on the side view, things look, you know, good as well. So
there's no step there now at all, is there?
No.
The bump is completely gone.
Completely gone. And now it's a question of just getting his range of movement back, getting his pain under control, and then working hard with the physios to go from there.
Looks good.
It wasn't as good a sleep last night. My knee started getting a bit sore about 2 o'clock. I didn't get sleep between about 2 and 4, and I took some cocodamol tablets. You got to be careful not to itch the actual scar line. You got to get around the side. And also my knee's gone very yellow today. It's bruised right up.
Right, James, second day of being at home. Tell us a bit about your setup.
Well, obviously I can't go up and downstairs at the moment, so I've got my mattress downstairs in the lounge. Duvet, I've got the big TV on with Wimbledon on at the moment, so that's alright. Toilet downstairs as well. My parents get food for me, so I don't have to keep moving through to the kitchen, because the first few days your knee can be quite sore walking on crutches. You can't do... Oh my god, pause it.
5 days post-op, tell us about your knee.
I'm doing my second set of exercises for the day, so I'm getting my knee to more or less 90 degrees, and that causes the stitches to weep just a little bit, so I'm having my dressing changed probably in a couple of days.
Did you dress it okay?
Today I'm going to have my last blood thinning injection. When you're over the age of 16, you've got to have one of these every day after you leave and while you're in the hospital. You've got to have it after for 10 days, and your parent will do it. They'll get shown how to do it by the ward staff before.
Okay.
Yeah.
Just a quick injection. Squeezing the tummy, putting the injection in and needle out. And it's a bit sore.
Yeah, it's a little bit sore. Might drop it a bit on the rug. First trip to physio, the first thing we're doing is checking the knee bend and the knee straighten, so pushing my knee down into the bed, seeing the angle that my knee's at, and then bending up to I can reach about 80 degrees on the bed at the moment. My days at the moment, because I can't really get up and do anything, mostly consist of watching some TV and play some games like Uno when I get really fed up, and I'll go on Xbox for a bit.
So we're now about 16 days after we operated on James. He's been discharged home, and he's very kindly agreed to speak to us over Skype. He's obviously been doing a diary so that we can be following his progress, and we're now going to catch up with him to work out exactly how he's getting on.
Excellent. Let's Skype him.
Here he is.
Hello.
Hello.
Hey James, how you doing? Should we go to the camera?
Yeah, can you see us?
No, we can't see you.
No, can't see.
Click on the middle one. There we are.
There we go.
How you doing?
I'm alright, thanks. How are you?
Yeah, very well, very well. We just wanted to catch up with you, really. We obviously had a chat with your mum last night. Thank you very much indeed for the footage that you've been sending. It's been really good. How are you?
Just fed up, as
Yeah.
Mum said, I'm sure. I can't get out and do things. I've been out in the garden a few times, but that's about it. I'm getting strength back in my knee. I can raise my leg at about 30 degrees.
Well done.
And I can do that a few times in a row before it starts to get sore, and I'm getting closer to straight leg raise, still not that close to it though.
Good. How's your pain?
No pain at all, really.
Well done.
Since I had my dressing off, wasn't it? I haven't taken any pain meds. That was about a week ago, so.
Okay. And how's the swelling?
It's gone down quite a lot. It's on my thigh. It's completely gone now.
Yeah, you're pretty good there. Yeah, that's good. So the wounds are okay by the looks of things.
Yeah, it's closed up really nice.
Yeah, excellent.
So that you can see the difference in swelling.
Yeah, very much so. Very much so. Go on then. Show us your party piece. Show us your quads contracture. Good boy. Well, that's fantastic. Well done. And how's your bend coming on?
When I'm sat, I can bend past 90 degrees.
Well done.
Tell me if I'm in position. I'm going to have to sit up. Okay.
That's well past 90.
That's really good. It looks like 110, something like that, from the angle we're at. That is brilliant. Well done. And how does the kneecap itself feel?
Kneecap's completely fine. I'm starting to get a little bit of a click there occasionally
Yeah.
when I bend my knee.
Yeah.
But that's going to happen. I've had the same on this knee.
Yeah.
It's alright with that.
Good. Fantastic. So you're basically just getting bored and frustrated now.
Yeah.
That's always a good sign. It's always a good sign. And how's the physio going?
We had one physio session, was it 2 weeks ago-ish, and we've got another one this Thursday.
Yeah.
And that's been alright. We went down, she didn't want to be on camera, but she showed the exercises and I talked through the exercises and as I did it, and I haven't had a problem with them. I've been doing maybe twice or 3 times a day depending on what I've been doing.
Brilliant.
Since I've been in the car, I haven't been doing it as much.
Yeah, sure. How's your pain in the car? Because that was a bit of a struggle, wasn't it?
When we went back from Norwich, I sat on the back seat and stretched my leg out across.
Yeah.
And sat in the front seat now. The first time we went out, maybe on the front seat, but I can bend and have it straight now comfortably.
Good. And do you feel a difference in the tracking of the kneecap as you're bending it?
Oh yeah, definitely, yeah.
Yeah,
Feel it.
fine.
There's no movement outwards at all. I could feel that from the day of the
Yeah.
surgery.
Yeah. And how about how does it compare to the other side?
I feel in comparison I'm further ahead, aren't I? I think I'm a bit further ahead of where I am in terms of physio.
Yeah.
Mostly I know what I'm doing. I was a bit more nervous with my other one, knowing what I'm going to do with my physio. Like I was a bit more nervous trying to do the straight leg raises because tensing my kneecap, pulling it towards me was where all the swelling was, and I was a bit nervous about doing that, but I'm alright on this one because I know I've done it before, it'll be alright.
Yeah, good. And how are you getting with things like mobility? How are your crutches and things like that going? Are you still on crutches? Are you one crutch or?
Still on crutches. When my mum's not looking, I'm doing sure.
You're furniture walking like a toddler as well, are you?
Well, I can walk reasonably. I can walk from here across to the other side downstairs without crutches if she's not there.
That's really impressive.
With crutches, I'm walking fine with them. I'm fully weight bearing on my left leg.
Yeah, good.
She's appeared in the door now, so
Yeah, quite. We got to stop talking about that bit now. Yeah, you're clearly obeying. Yeah, fine. That's fantastic. Well done. Anything you want to ask us?
Not really. I mean, there's just a couple of stitches sticking out, but I know that's fine. We can just have them pulled out.
Yeah.
Call surgery when that happens. But that's fine.
Brilliant.
Really fine.
Thank you. We've been going through the footage that you've been sending. It's really good, particularly the bits with the cat in. That's always an absolute winner. Thanks for that. I like the get. She also won at Lotto or whatever it was.
You know.
Pardon?
She beat you at the card game.
Get in there.
That was the one time she
Great. Okay. Look, we won't interrupt your afternoon too much, but thank you very much indeed for taking the time to talk to us. Anything else that you want us, that you need to tell us, or anything that we've missed?
I don't think so. We've been through everything. With my knees completely fine, so I'm all good.
When we were setting up the call yesterday, when we were chatting to his mum, and basically she knew that she knew that he was getting better when he started to basically get bored, which is exactly what you're seeing. He's doing really well, and that's because we've done the other side basically. So he knows what it's all about. Also, he's well motivated. He's working hard. So he is. Yeah, he's progressing really well.
Yeah, his knee bend was impressive.
Really impressive.
Wasn't it?
Yeah.
And as you said, he is more. I think he's more confident in all of his exercises.
Yeah.
Because he trusts it, because the other side has worked. And he knows.
Yeah.
He knows what he's going through.
Yeah.
Yeah.
So we'll catch up with him in 4 weeks' time.
It's day 22, post-op Tuesday. Foot up, tense the quads and try and draw the kneecap up this direction towards me, and then push down into the bed for 5 seconds.
You're going to do your physio? Or do the neck exercise?
I've been able to come out through this door for about a week now. The main problem with it was that it goes up and then back down to get out, which is the difficult part. It's better to come outside, get some actual fresh air, but I can't sit here for too long because it's not soft enough to provide support underneath my knee. This exercise, going from sit to stand, the aim is eventually to get 50-50 weight distribution between the two legs and then slowly control the weight back down. It's day 24 post-op. I'm now using my crutches much less, no mattress here because I'm moving back upstairs. It's now 5 weeks post-op. I'm going for my first proper walk outside. We've been delayed the last couple of days due to rain. I'm going for a first proper walk at the moment. I've passed my French, I've got no need for my French anymore. So my parents have said I can burn it all. My brother's got some of his old French as well that he's not going to use, so he'll burn that as well. We're now 5.5 weeks post-op. I would have shown the new exercise inside, but we did about 5 to 10 attempts at different variations of straight leg raises, and that really took it out of me. Tired and fed up, I can't really get out and do anything. Wounds have completely sealed up now. It's been like that for, I'd say, 10 days, 15 days. I had my last stitch fall out. It all the way along it is completely sealed up and down it. On the outside there is barely any visible mark of the scar now. Depending on what I'm doing, the scar can change colour. So once I've been stood up for a while, it goes completely dark purple. When I'm just lying down, it'll be a reddy colour, and when I've got it bent for a while, it will usually start to go a bit white. Also around the scars, I've got absolutely no feeling from about here down to there, up and down on my skin on either side. This is an exercise for the quads. Right foot first. It's working just above the kneecap. Swelling again is probably the most difficult part, stopping me from going any further. Okay, so 8 weeks post-op today. I've just been for a mile walk with my granddad, who, funnily enough, had surgery on the same day as me, on the same knee. He had a full knee replacement, obviously I had what I had. How do you feel after walking about a mile-ish?
Well, I've enjoyed the walk, without any doubt, with your company. So, yes, my knees feel reasonably fine and strong. I can straighten my leg a little bit more than James, but not much, so he's coming along fine. Like everything else, it just takes time to get done.
Do you feel anything sore up and down your leg after it?
I do get a slight pain down the centre at the back of my knee, and upper leg.
I get the same there.
Just a short, sharp pain, occasionally, not all the time.
I'm going to the gym again. I usually do 2.5 kilometres at a reasonable resistance.
Tomorrow I'm back down to Norwich to see Mr McNamara.
I think you keep supporting and you keep giving advice and you keep encouraging, but ultimately it has to come from him, and he has to find that motivation to do what he needs to do. I think coming back to see Mr McNamara early October was really important for me to take him down, because I felt it was just because he'd had the summer off and he'd done some rehab exercises, but he was back to school and he was really having to use both his knees a lot more than he ever had to. And it was going to get sore and it was going to get painful. It needed someone else, an expert, to say that, not mum, because mum just gets pushed to one side, as mums do.
Fine, so we're just about to go and follow James. He's now come back for his first post-op visit. But how is it?
I'm now one-legged squats and things.
Yeah.
I'm reasonably happy with where I am.
That's the hardest bit, getting from there to there. That's the control bit. You know, that and the real straight leg raise. But you're doing really well. The behaviour of one cannot predict the behaviour of the other, trust me. You know, they're very different beasts. In terms of pain, how are you doing?
I haven't had any pain, I mean...
Fantastic. Can I have a quick look, is that all right? Can I rest you down? Yeah, you know the drill now, don't you? Fine, not the first time. Fine. Oops. Okay, let it go floppy. Hips are okay? Good. Just push down hard on both.
That's all right, I have to move my shoes.
Oh, yeah, it's your shoes that are a problem, is it? Okay, fine. Good man, well done. And bend it bent. You're pretty close to having that final bit of control, aren't you? Really close. How are you around here?
No, I don't feel pain.
Around here? So if you just push down hard again, just lift straight up. Now just lift that straight up in the air, see what you can do. You've got about, you've got a little lag, haven't you? It's about 10 degrees, which is pretty impressive though. That's, 6 weeks or so. Just swing your legs around if that's all right. So you're off the side of the bed. You're nearly there, aren't you?
I can get it up, but it's got...
But you're doing really well.
I don't have much feeling around the scar, but I knew that was the same with the other one. I don't have a problem with that.
No, it's impossible really to do it without that. Just because you've got those tiny nerves, you can't see any of them. Yeah, exactly. Some people say they regrow. I think people are left numb, certainly on one side, if not both sides. Sometimes it comes down the shin as well, because that can pick off that little nerve there. No, often you have a tiny little bit of synovial irritation. So when we do all the work, we pull the synovium back, which is just the lining of the knee joints, and then you put it back over again, and of course it becomes bunched and inflamed. So therefore things are riding, and it's often a soft tissue click more than anything else, which just evens out again as the muscle controls back, comes back, and the scars begin to heal. As they go whiter, what you're seeing on the outside is essentially what's happening on the inside as well. So, that redness and that inflammation is still there. In complete honesty, I don't think I was as committed to exercises on my left knee as I was on my right knee. I'd got a bit frustrated. The first 3 weeks, maybe a month of exercises being the most important, they were probably the slackest period post-op. And that has a cumulative effect on 2 months down the line, 3 months down the line. If it's not strong enough when you go back to school, it can build up pain quite quick. So James, we'll just do your scoring system of the one that's at 1 year now, okay, which is the old knee. Whenever we operate on any of our kneecap patients, we always score them before the operation. We score them in 2 ways, one of which is to work out how much pain they had before from their kneecaps, and the second is to work out how bad their instability feelings are. And so the first score is the Kajala score, which is an anterior knee pain score, front of the knee pain score, and the second one is the Norwich patella instability score. Any problems jumping off that knee? No. Any problems keeping your knee bent for periods of time like you are at the moment? No. Any pain when doing that? No. Any swelling? No. Pain after, swelling after doing the physio, those kind of things?
No, my right knee.
No, fine. The right knee scored perfectly on the scoring systems. The left knee, I'm really interested to know how you get back to sports over the next few weeks, but I think you've done really, really well, and it should be good. So keep us informed, and well done. Nice to see you. Very much. Safe journey on the way home.
Thank you.
Cheers, take care.
Thanks very much for everything.
Pleasure. Bye.
You build a relationship, and that's something that for you, I think, was quite easy, that relationship to build with the surgical team and your consultant. So I think, you know, everybody in that team, including James, has that working relationship and that respect, and that's really important, that relationship that you have with your surgical team, so that you've got the confidence, because there was never any doubt.
No, I knew Mr McNamara knew what he was doing. He'd explained it all to me, and he's done it before. He knows what he's doing. What's the worst that can happen? Go ahead.
Yeah, and over time, a long period of time, I guess, with working with him, you've built that
4 years, yeah.
That relationship. And
oh yeah, 100% you have the surgery. There's no doubt about it.
There's no commission required, is there? Mr McNamara doesn't need to be a penny in commission. You would shout from the rooftops.
Yeah, definitely do it. It's going to end so much better than it was before, no matter what. Yeah, 100% have the surgery.
How do you see James, and particularly, I mean, then I'll ask your mum, but how do you see the whole recovery process and what's happening at the moment, put into perspective, impacting onto your plans?
Well, I was at the point literally just before we went into lockdown where I was thinking about properly getting on the tennis courts and having a hit and getting back into playing regularly and being able to play without a worry, really. So that's kind of impacted that side. But I guess with the lockdown, it's given me more time to keep up with schoolwork and recovery in the gym and things. So, I mean, it stopped me getting on the tennis court, which is unfortunate, but it means I should be stronger when I can get back on the court. So I suppose there's two sides to it.
So are you still keeping in touch with the hospital or Mr. McNamara, or that's completely from your point of view, you don't need to be back to keep in touch with the surgeon, or you need to come and see them in 6 months, a year, or that's because I don't remember on the last appointment exactly what was the final decision.
I think it's September, is it?
Yeah, you had an appointment for September to go back for another check. So that'll be your 12 months for your second knee.
Well, 14 months, but roughly 12 months.
Yeah.
And is that still in place, or we playing by ear? We'll try to see what is the situation with the coronavirus, the pandemic, and
the appointment's been put in for, I think it's the 4th of September, but I would imagine it will all be dependent upon if there's a second wave of virus that stops and the lockdown goes back in place again or not. But at the moment it's at September. But I think that's really more for another MRI to look at the knee to see how it's progressed internally. As far as you're concerned,
no problems.
Both knees are doing great. There's been no issues.
Skype video. Hi, Lorenzo. So yeah, I mean, as you can see, I'm in the hospital at the moment. Things have changed somewhat, as you're fully aware, because I think you're down in London at the moment. Basically, the plan with James was that we'd seen him for his follow-up. Things seemed to be progressing really well. He was rehabilitating well. He seemed very happy with the way things had gone. His plan was he's going to get back to playing tennis, and then we were going to catch up with him in about September for the year follow-up, and then go from there, really. And we were looking forward to seeing him back on the court and sending some footage down. Unfortunately, since then we've had a global pandemic. We've been hit by coronavirus, which is a virus that really seems to have originated out of China, or that's what we know at the moment, and has really sort of swept across, going from east to west across Europe. So the current status is really that we've gone into lockdown. So the hospital has changed amazingly. I mean, it's not the hospital that we were certainly filming in a few months ago. Normal outpatients has changed. We're not seeing routine face-to-face patients. We're not doing any kind of routine operating. Almost overnight, the hospital got segregated. The corridors got segregated. Wards got segregated into potential COVID wards. I mean, certainly we've never dealt with this on this scale in the past. In terms of James, I mean, we haven't caught up with him recently. I presume he's not at school because there aren't very many people at school. The universities have essentially been sent home, so I presume he's working from home. Exams are going to be changed, we think. but there's no clarity on that at the moment, so I don't know what's going to happen. Wuhan is ahead of us. Many of the European centres are ahead of us, and they are seeing the spike and then the downward trajectory. So there's no doubt about it that we are going to come out of the acute spike. The problem is going to be what kind of effect is it going to have? And we've gone from really black and white to huge shades of grey. It's not going to be a case of, well, we just get elective practice up and running and it's going to be fine, we're going to catch up. This is going to have economic effects. It's going to have effects upon schooling. It's going to have effects upon elective surgery, trauma surgery, have effects upon every aspect of life for probably many years, possibly even my entire working career. So I think that from the treating the virus and getting a vaccine possibly, which people are talking about, I'm sure that we will get some kind of happy medium there and life will return to a certain degree for that. But in terms of the longer term effects, in terms of people who are in time critical aspects of their lives, I think that some of these effects will go on forever. Thank you. Well, stay safe, as they say.
You wouldn't have been at Norwich, although your first big dislocation happened at that school. It actually put you in the right direction to get the right consultant and the right outcome. It's fate.